Hi guys, it's Diane from Early to Bed, Early to Rise, and I'm a physician assistant. And today we're going to talk about hormones. Specifically, we're going to talk about women's hormones and how to get balanced hormones. So there are a lot of moving parts in hormones, like other pieces of health as well. And hormones can really mess up how you feel, how much energy you have, how your day-to-day life goes when they're out of whack. So along with all these other holistic health topics we've been talking about in this Insider's Guide to Holistic Health, I want to make sure that you know this is not just your hormones. There's also play from gut health in this. If you've got inflammation there, you will have hormones out of whack. And if you're consuming environmental toxins like BPA and the lining of canned goods, those are known endocrine disruptors. So you will have messed up reproductive hormones, or you can very significantly with that. If your thyroid's out of whack, thyroid plays a role in the reproductive hormones. We'll discuss that later a little bit. That can definitely mess things up in how your female hormones are, and your stress response, how well you sleep, all those things that are controlled by the HPA axis and your adrenal glands. If that's not healthy, it's really hard to have healthy, balanced female hormones. So we're going to talk about main players. We're going to talk about what the typical responses are from the hormones that you should see in your menstrual cycle, and then we'll go into a few other things, symptoms, and touch on some PCOS, and then we'll talk about labs and treatment. So definitely things we can do to get you feeling better, but don't forget those other core things we talked about too. They're all related, and watch those videos, please. So main hormones that happen for females, we want estrogen levels. Estrogen is known as the growing hormone. There are a couple different types of estrogen. Estrogen helps to grow the lining of the uterus. So progesterone is the other big player. It's the relaxing hormone, and it also helps to sustain pregnancy. Testosterone, believe it or not, ladies, we need some testosterone. It can help with a general, like joie de vivre, like that, like feeling of like zest for life. It's also super important for muscle mass and bone density. Not just big strong muscles going to the gym, but your heart's a muscle too, and you want it to be nice and strong for a good long time. So it's also important for libido. That's probably not a surprise that your sex drive is controlled by that. So anyways, that's a big one. And then DHEA, that's made by the adrenal glands. It is the precursor to a lot of these reproductive hormones. It does a lot of great stuff on its own too, but that's the part we're going to focus on today. So FSH is follicle stimulating hormone, LH is luteinizing hormone, so they're all important parts. The menstrual cycle starts at menarche, which is the age you are when you get your first period, and menstrual cycle ends at menopause, when you have your last period and stop having any more. Doesn't mean you can't have imbalanced hormones, those are just big terms. So day one of your menstrual cycle is the first day of your last period. Your estrogen and progesterone levels are at their all-time low for the cycle, and your pituitary gland picks up on that and tells the body and releases more follicle-stimulating hormone, FSH. So that gets sent out, and this is the follicular phase, this very first part. So FSH starts a follicle, which is an egg in a little sac with nutrients in the ovary. It starts it growing. So for most women, this cycle we're going to talk about, it's about 28 days. It can range between 24 to 35 days. So if you've got PCOS, it might be super infrequent. You have no idea. So as the follicle grows in that day 1 to day 28, day 1 to day 12-ish, as that follicle is growing, it's also sending out more estrogen to build up the lining of the uterus and get the body ready for pregnancy. So the ovulatory phase occurs around days 12 to 14 for most women, and there's a spike in estrogen, a spike in testosterone. It triggers the pituitary to release luteinizing hormone, or LH, and get the body ready to release the egg from the follicle, which happens in that little time frame. Typically, for a lot of women, when this happens, because there's that rise in estrogen, you feel a little more womanly in a good way. Usually you feel a little more inclined to dress up, put some makeup on, and that's part of your body saying, oh, let's get ready for pregnancy, to do the things that lead to pregnancy. I'll leave it there. Anyways, if you're married and you want to have a baby, that is a great time to go on some dates with your husband. We'll leave it there. So after that, you enter into the luteal phase of the cycle. So the body continues to try to progress to pregnancy, and the ruptured follicle continues to secrete progesterone and estrogen until the end of the cycle to get everything ready. So day 28-ish, if you haven't gotten pregnant, you have a decrease in your estrogen and progesterone, and that signals the start of your period, and then we do it all over again. So unfortunately for us in this day and age, it is not uncommon for women to have imbalances in their hormones. There are a lot of different symptoms that are possible when your hormones are too high or too low, and a lot of different things that can play a role in it. Inflammation in the gut, environmental toxins, thyroid. The thyroid plays a role in regulating reproductive hormones and metabolizing them. Specifically, that means breaking them down. So if your thyroid isn't working like it should or at its optimal level, you can have too many reproductive hormones hanging around for too long. We see that with PCOS, especially with testosterone. So, get to that more in a minute. So PCOS is one of the things that can throw off the balance to your hormone. If you're not sleeping well or enough, if you're significantly stressed, be that life stressors with hard things you're working through, or even happy things like moving across the country, new challenges sometimes can put stresses on you. So if you're going through some stressors, your adrenals and your HPA axis may be not producing what they should. That DHEA and cortisol and some of your reproductive hormones come from your adrenal glands. So one of the classic examples of your hormones not being balanced optimally that you feel is menopause. Super, super low levels of progesterone. A lot of postmenopausal women that feel like they have symptoms also have like negligible, barely registers DHEA and testosterone. So, I mean, that's what I've seen clinically. And then they tend to be estrogen dominant, even though there's not much of that either. And when the ovaries decrease their estrogen production at menopause, you're still getting some estrogen from fat stores and from your adrenals. So all those things can not balance your hormones. I want to take a minute and say, if you have gained a lot of weight that you're struggling with, or if you struggle with like eating disorders, not eating enough, those can also throw your hormones off. The stress response that people get when they struggle with anorexia or really low body weight is the adrenals and the HPA axis are kicking in so much, we're not producing those reproductive hormones, so you won't have a period. Things are not healthy in that state. Women typically need 10 to 12% body fat to be able to produce their reproductive hormones. It's important to not be too skinny. On the other end of things, things can get very out of whack if I see patients with that are far outside of a healthy body range for them. Excess weight, particularly around the abdomen, can release some estrogens. They can, in what we were talking about before with PCOS, you can struggle with testosterone being too high, those sort of things. So working to be at a good, healthy body weight can be important for hormones. I know that's hard, so there's lots of other resources here on the blog about helping you get to a healthy weight, and there's lots of players in that, so don't stress out, just throwing out some stuff that's important to know. Okay, so symptoms of low estrogen, low progesterone tend to include brain fog, difficulty concentrating, trouble sleeping. I see a lot of secondary insomnia with this. You hear it from perimenopausal women about the hot flashes, and that's definitely part of it. But just in general, if you wake up a lot in the middle of the night and can't go back to sleep, more than just trouble falling asleep can be it, but a lot of it's secondary insomnia. You fall asleep, you wake up in the middle of the night, can't go back to sleep. That can definitely be hormone related. Other things, low estrogen can cause vaginal atrophy or dryness. The tissues just aren't quite as comfortable, and that can lead to painful intercourse, decreased personal lubrication down there. So important things to keep in mind. Of course, if your hormones are out of whack, that can play a large role in having trouble conceiving to have a child. So infertility is on that list. Irregular menstrual cycles, really heavy bleeding are signs that things are most likely off with your hormones. Fibroids, endometriosis, thyroid dysfunction, kind of a two-way street. Sometimes when your reproductive hormones are off, your thyroid's going to be off. Though usually more likely thyroid causing that, but still a possibility. So mood changes, anxiety, depression, moodiness, mood swings, all of that can be related to funky hormones being off. So, and fatigue, if I haven't mentioned that one already, and headaches. So I want to take a minute to talk about PCOS in particular. The medical community will talk about PCOS, the conventional medical community. We'll talk about PCOS being important because of its role in insulin resistance. If you have PCOS, you typically do not recognize the insulin that you're making very well, and you don't use it well. So sometimes your body makes more and more insulin, but you don't use it well. So you're not controlling your blood sugars well, which is insulin's main job, to put sugar where it needs to be, not leave it floating around in your bloodstream. And this ultimately can lead to type 2 diabetes, where we don't use the insulin we have when we run high blood sugars. I have read from several different holistic healthcare providers that the question is more so, do we have this inflammation from from the insulin resistance causing PCOS, versus the conventional medical community says, oh, you have PCOS, therefore you have insulin resistance. So anyways, chicken or egg, just wanted to throw that out there. PCOS, it's been postulated it occurs in 1 out of every 10 women. The condition itself is when the ovaries make multiple cysts instead of just one cyst, like you should during your typical menstrual cycle. It means your hormones are not working in the way that they should. So what we see going along with that is reproductive hormones being out of balance with a large dominance for androgens and testosterone. So the symptoms we see with that tend to be infertility, irregular menstrual cycle, things that would go along with high testosterone. Not super jacked muscles, but unfortunately hair growth in places you don't want it, like your face. Typically there's some balding that occurs too. I call that hirsutism. Increased risk of heart disease going along with that insulin resistance picture. Difficulty losing weight. So a lot of women with PCOS struggle with obesity, and going along with that being sleep apnea, so you're not getting good sleep. So it's this vicious cycle of messing up your HPA axis because you can't sleep, plus your hormones are all out of whack. So we will talk about those treatments specifically for PCOS that you should add on when I hit the hormone treatment. So labs. General labs, if you're worried about your hormones being imbalanced, are estradiol, type of estrogen, that's typically the one that we test, progesterone, testosterone, DHEA, LH, FSH, and then thyroid, because that plays such a big role. So you want a TSH, a free and total T3 and T4, and a lot of providers are adding on anti-thyroid peroxidase antibodies. They are an indicator of Hashimoto's thyroiditis. Check out the thyroid video, but because thyroid plays such a role in reproductive hormones, worth testing. And another one to add on there would be checking that HPA adrenal axis, and that's a cortisol level. DHEA and cortisol tend to be saliva tests. The rest tend to be blood tests. If you have PCOS, additional testing that goes on, and this is probably going to be through your GYN or an endocrine specialist, would be a transpelvic ultrasound looking for those cysts, or a pelvic CAT scan or MRI. Those carry greater risk than just doing an ultrasound. That seems to be a lot safer. So, and that's usually the treatment of choice. It's cheaper, it's faster, it's less invasive. Not invasive, but less risk. So other labs that get done would be checking insulin levels, blood sugars, possibly hemoglobin A1C, that's your average blood sugar over the last 3 months, serum prolactin levels. Some endocrinologists and GYNs will actually check your cortisol level too in the blood, but the more helpful cortisol levels are the saliva ones that you do throughout the day, so you can map out your cortisol levels. All right, so what do you do when your labs come back and you see where you are and you don't have what you need and you have too much of one thing and not enough of another? So my favorite treatment and what seems to be the most effective symptom-wise would be bioidentical hormones. You need to get together with a holistic healthcare provider and let them manage that. So they'll be able to look at your labs, see where you are, and be able to make recommendations and get you compounded medications or stuff you can take by mouth that will look like what your body should be making. So never, ever, ever, ever take estrogen unopposed without progesterone along with it. It can significantly increase your risk of different cancers. Estrogen also carries the increased risk of blood clots, heart attack, and stroke. So you need somebody to keep an eye on you if you go that route. But there are things we can do even now while you're waiting for your labs to come back. There are some fantastic things you can do. So those big things that all play a role in the reproductive hormones, keep them in mind. Gut health. Check out the Leaky Gut lecture, food allergies, inflammatory things that could be happening in your gut. Work on good gut health. That will help your hormones. Then the HPA axis, your response to stress and sleep and supporting your adrenals, and that whole axis, super, super awesome for helping your hormones get back on track. Optimal thyroid health. I know I've said that like 5 times. You probably hate it. Okay, I'll leave it there. Toxicity, making sure that you are drinking clean filtered water, that you are eating organic, lots of fresh fruits and vegetables. Focus on getting those good omega-3 fatty acids in your diet, giving your body the things it needs to not disrupt your reproductive hormones and to build good, healthy reproductive hormones. Exercise. If you've got really bad HPA axis dysfunction, focus on that and come back to your hormones when you're ready, when you feel like you're healing up. Over-exercise can definitely tax out adrenal fatigue. When you're ready for this, high-intensity interval training can be super, super helpful for stimulating human growth hormone factor, and that can help to balance out those hormones and get you where you want to be. So diet in general, focus on low glycemic index foods because you don't want to end up with the insulin resistance picture and the inflammation that goes along with that messes up your hormones. You also want to make sure that you cut back a bit on alcohol. Alcohol can play a role in disrupting hormones and where they should be, particularly if done in large amounts. If you're really feeling unbalanced in your hormones, just stop for a while. And consider going gluten-free because of the inflammation that comes along with gluten. And then dairy-free. Even organic milk can come from pregnant cows, which will be additional hormones that you just don't need when your hormones are not balanced. So I'm so sorry to say that, but they're probably not your friends when all of your stuff is not balanced, right? So supplements, drum roll, yay! So there's a lot of different things that can be helpful. Vitamin D is fantastic, and vitamin B, the whole B family is really what you want, but I've seen specific mention of vitamin B8 are very helpful at starting to give you the building blocks to balance those hormones. Calcium and magnesium. Magnesium especially awesome for PCOS because it can help improve insulin sensitivity. I recommend taking magnesium at night. I like Natural Calm a lot. It's a little drink you mix up and you can drink at bedtime. Magnesium's good at relaxing skeletal muscles and can be very helpful at promoting a good night's sleep. So it can help sleep issues related to hormone stuff as well as help you build better hormones. Omega-3 fatty acid supplementation can be good. GLA in particular is an omega-6 fatty acid that can be really helpful. That's gamma-linoleic acid. Flaxseed can be a good thing to take too. Flaxseed is super high in linoleic acid, so it can help with the right type of estrogens, promoting a good healthy balance. Two particular supplements that can help for balancing female hormones can be evening primrose oil as well as Vitex. So Vitex can help overall hormones, but especially supporting progesterone production and can be helpful in people who are trying to get pregnant. So, and then essential oils. So I will do a whole post on CBD oil because that's kind of a new thing. Cannabinoid. It's not a new pathway. It's actually been something they've been looking into for medical things and related to insulin resistance. And they've been studying that for like 15 years, but nothing has come out in the conventional medical world yet. Excited about that. CBD oil comes from hemp. It's not supposed to be marijuana, but it depends on where you get the formulation from. You may actually test positive on a urine drug screen. So again, I'll do a whole post on that. But sometimes CBD oil can help to balance your female hormones and help you feel better. Other essential oils that can be good players would be sandalwood. It can help to increase your libido and promote relaxation. Clary sage can be helpful for estrogen production, and thyme can be good for progesterone. So for PCOS in particular, make sure you're getting that magnesium. Also, you may want to add in chromium picolinate. It can help your body be a little more sensitive to insulin and reduce your glucose levels, your blood sugar levels. And then additionally, on top of that, like definitely the low glycemic index diet. But there's a really cool study that came out recently that showed women who ate the majority of their calories earlier in the day and ate a little less later in the day had decreased insulin levels, decreased glucose levels, and decreased testosterone levels, which is a big thing for PCOS. So the study was done with they ate like 960 calories for breakfast, 640 for lunch, and 190 for dinner. That sounds terrible to me. I don't think I could go that low, but just keep those kind of guidelines in mind. Focus on having a lighter dinner, eating more of your calories earlier in the day, and then just see if that makes a difference for you. It's not going to hurt anything. So anyways, hormones. So much happening, but it can help you really feel like the best you. So hope you're having a great day, and thanks so much for joining me. Bye.